What are the hidden dangers of cheap home care? Maybe you have an agency that is giving you a much lower price than the others, or maybe you have a private caregiver who is a great deal. You might be wondering if there is anything you should be worried about. Is there a downside to cheap home care? Sometimes you get a great price and an amazing deal, and that is fantastic. We all know how expensive home care can be. However, there are a few things you want to look out for. Here in Florida, there are different levels of care provided by each agency. You may find a much better deal with an agency that is only authorized for homemaker and companion care and not authorized for non-medical care. What does this mean? This means that they are not allowed to touch the client in any way to provide personal care. They can provide companionship, they can clean the home, remind them of medicines, but they cannot feed, bathe, assist with the bathroom, give medications, help transfer the client, take vitals, fill a medication box, or provide any care where they are needing to touch the client or any care that is considered skilled care. In Florida, these companies do not always have to have the same workers' compensation and liability insurance that other licensed agencies are required to have. You will want to ask about their licensing and insurance because the lower rate may be due to the fact that they cannot provide the level of services that other agencies can. They also may not carry insurance that you may need. Another hidden danger is how the agency classifies their employees. You will want to check and see if their employees are 1099 or W-2 employees. Why does this matter? It matters because if they are W-2 employees, they are likely covered by workers' compensation and liability insurance by the agency. If they are 1099 independent contractors, that responsibility often falls to the family that they provide care for. This means that if the caregiver gets hurt in your home, or if they break something, if your loved one is injured, you can be responsible not only for your own expenses but also liable for their expenses as well. With an agency, you may pay a higher hourly rate, but that rate does come with increased protections. If any agency is offering a much lower rate that seems too good to be true, it could be. They may be paying such a low wage that you need to be cautious about high staff turnover or no-call, no-show staff. They also likely do not offer the supervision and strong training programs, as these lead to an increase in costs for high-quality care. Next, the Department of Labor is something to consider. The Department of Labor has separate guidelines for home care staff. The Department of Labor and IRS require you to report their taxes, pay them overtime over 40 hours, and also pay them minimum wage. An employee or anyone else can report you to the Department of Labor for failure to do these things, and that can come with significant fines. There are obviously some financial benefits to cheap home care. However, it is important to be aware of the potential issues that may arise by hiring cheap home care services or direct care employees.